everything people get me in this hospital is not okay.
What do you mean? How?
It's not original.
Where did you get it?
From your job stuff.
How did you apply it? I don't understand. How did you apply it?
This way. You don't know how to apply it.
That's not how you apply this, okay? Just sit down. Let me explain to you how to apply this. But to start with, I don't condone this in my office. I would have called the security to walk you up from here, because imagine pushing me in my own office. No. But let me just explain this for you. But just have it in mind never to try this again.
Okay, so this is how you do this. When you get a medical device like the aeroline inhaler, you either ask them questions on how to use it, or you check out for the manual in it. And this is how you use this now. You open the mouthpiece, then you breathe out as comfortable as you can, and you place it in between your teeth and close your mouth. Remember not to bite it. When you've done this, you breathe in and you then press the canister. After you must have done that now, you continue breathing in. When you bring it out, you slowly breathe out. Is that understood? So if you decide to pop again, you do the same thing, right? So next time, don't walk into my office this way. I can just call security on you, because that's crazy. I don't expect patients to be misbehaving in the office.
Next time I spot this time around.
Of these patients.